Hello, everyone. Unfortunately, Carol couldn't be here today. She is the PI of this project and the pharmacy manager at the Dr. Everett Chalmers Regional Hospital in Fredericton. But I want to thank you on behalf of both of us for letting us share why this project was done, what we found, and our recommendations. So this project, the Hospital to Home Pharmacy Research Project, was funded by the Healthy Seniors Pilot Project and the Maritime Sport Support Unit in St. John supported this project as well. They helped with the grant application, um, the study design, data analysis, and sharing our findings. So the H2H program, which you will hear me abbreviate hospital to home as H2H during this presentation, ran in Fredericton from February to October 2023. And it aimed to improve medication management for older adults leaving the hospital and to improve communication between hospital and community pharmacy teams. So I'm going to explain why this project was done. So first, we're going to start with a story about Paul. So meet Paul. Paul is a 75-year-old man who recently suffered a stroke and was hospitalized. Before the stroke, he only took 2 medications. During his hospital stay, doctors added several new medications and changed his existing ones. When he was discharged, he had a completely new and unfamiliar medication regimen. The nurse quickly reviewed his medications before he left the hospital. He was delayed at his community pharmacy because the pharmacist needed to contact the doctor for clarification. Although the pharmacist tried to explain, Paul didn't fully understand why he needed the new medications, but anyways, he left the pharmacy feeling slightly unsure. At home, Paul felt lost and overwhelmed. He stared at his pill bottles. He was worried he wouldn't take his medications properly, and he didn't know where to turn for answers. Without a family doctor and with a few weeks to wait for NB HealthLink appointment, he found the transition from hospital to home much harder than he expected. He felt lost, overwhelmed, and unsupported in managing his medications. So now let's meet Patty. Patty is a community pharmacist in Fredericton, say, who received Paul's discharge prescriptions just 20 minutes before he arrived. Okay. She saw one medication marked as new, but knew Paul had taken it before. Without details about his hospital stay, Patty guessed he might have had a stroke, but wasn't sure. She needed to clarify with a doctor, but they were unavailable. The pharmacy was bustling with activity, and people lined up at the counter. While waiting for a call back from the doctor, Patty filled Paul's other medications and helped other patients. Missing key information, she asked Paul questions but didn't have clear answers. Both of them felt uncertain and frustrated. Unfortunately, this type of communication gap is common. So now I'll explain the Hospital to Home Pharmacy Research Project. So for this project, the key research question was, what a pharmacy... Ooh, okay. Sorry, I won't explain it first. Um, so in investigating current issues that exist, Carol and pharmacy intern actually investigated this with community pharmacists in Fredericton. So they did an audit on the current state of discharge prescriptions written at the Chalmers. So this took place in 2019. And so based on the information that they collected on 18 discharges, they identified 3 main issues from community pharmacists who participated in this. Number 1, poor communication. Hospitals and community pharmacies don't communicate well, causing delays in getting new or uncommon medications and issues with drug coverage. Number 2, there was need for clarification for discharge prescriptions. There was often vague directions, missing documentation, medication discrepancies, and lack of information. It seemed that patients received unclear instructions and didn't know why new medications were prescribed. So this audit raised concerns, obviously, and so Carol and the study team reviewed the literature to see if others had reported similar findings. So going into our background a little bit, they found many studies that looked at medication safety during transitions of care, and it was found that medication errors and adverse drug events are common with hospital discharges. Nearly 50% of older adults actually experience a medication error or unintended medication discrepancy when they leave the hospital. And so, errors and adverse drug events are more likely if the older adult is taking five or more medications, which we refer to as polypharmacy, or has a complicated medication regimen, or is taking certain high risk medications. And so, transitions of care, like a hospital discharge, increase the risk that some medications will be missed or not taken properly, which can lead to serious health issues. And so, in needing better communication and collaboration between healthcare providers and patients, they looked further into the literature on how this has been done before. So the next literature review revealed the critical role of pharmacists in care transitions and found four more noteworthy studies on pharmacist interventions at discharge. So these were pharmacist care bundles at discharge, titled the Collaborate Study in Alberta, the Re-Engineered Discharge Program in Boston, the Farm to Farm Study in Hawaii, and the Optimist Study in Denmark. So all of these studies found an impact on hospital readmissions. I want to highlight the Farm to Farm program in Hawaii, which is particularly a large um, and convincing study in how pharmacist interventions at discharge can be impactful. So this one actually focused on high risk patients during transitions from hospital to home, and their outcomes were focused on medication related hospital readmissions. And they actually looked at hospital readmission ICD codes that were specifically related to medications on readmissions. And so they found that their program achieved a 36% reduction in medication related hospital readmissions and a 264% return on investment. Um, so quite a compelling study there. And so all of these findings highlight the important role of pharmacists in managing medications, reducing readmissions, and saving costs. They emphasize the need to integrate pharmacists into healthcare teams to better patient care and overall healthcare quality. And so, inspired by this evidence, the pharmacy TOC program, Hospital to Home, was created, developed to tackle New Brunswick's healthcare challenges. So now I'll describe the hospital to home pharmacy project. So the key research question was, would a pharmacy-led transition of care intervention have a positive impact on the patient experience, the community pharmacist experience, and the overall New Brunswick healthcare system? So on the hospital to home project study team, we had a patient partner who assisted in study design. And so to assess the intervention, key outcomes were chosen to focus on patient and pharmacist experiences during the hospital discharge process rather than hospital readmissions. So the intervention was implemented in one hospital, the Dr. Everett Chalmers Regional Hospital in Fredericton, in two acute care family medicine units. Two additional family medicine units served as comparison units where regular hospital pharmacy services were not typically utilized. And so patients admitted to these units were referred by providers within their circle of care, and study inclusion criteria required that participants be aged 65 years or older, regularly took medications at home, understood English, and had the capacity to provide informed consent. Patients were excluded if they had an alternate level of care designation, were palliative, or were transferred from family medicine to another service. This study design was quasi-experimental, and the intervention was evaluated via quantitative and qualitative methods, thus was mixed methods. So preceding the intervention start date, we had 18 community pharmacies in Fredericton and surrounding areas agree to participate in the study. And so community pharmacists employed at these pharmacies were consented and briefed on study requirements, of which, as they were instructed, would include their completion of assessment tools or surveys before, during, and after the intervention. So the hospital to home intervention itself was tailored to individual patient needs. So TOC pharmacists working on the two designated hospital intervention units provided a range of enhanced pharmacy services while patients were hospitalized and at discharge. These services included identifying drug-related problems, the development of pharmacy care plans, medication reconciliation, medication education, particularly at discharge, and providing medication lists or calendars to patients. TOC pharmacists also communicated detailed medication information through a comprehensive discharge summary to patients' community pharmacists. And as mentioned earlier, this study employed a mixed methods approach, collecting both quantitative and qualitative data. This was done through surveys, interviews, and focus groups to evaluate key outcomes. So a closer look at this. There's a lot to look at first, but for patients, data was collected at 3 time points. So this was baseline, 72 hours post-discharge, and 30 days post-discharge. So 72 hours post-discharge and 30 days post-discharge was completed via phone call to patients. So demographic information was first obtained at baseline in hospital. And then to assess patients' experiences at discharge, we collected data on patients' self-reported medication knowledge and confidence, barriers to medication adherence, and risk for medication not adherence. And tools used to assess these outcomes included the OCare-Renier, the Ask-12, and the Medication Adherence Estimator, which are all validated survey tools. At the 30-day time point, both a healthcare utilization questionnaire and a patient satisfaction survey were also completed, and some patients were invited to participate in semi-structured interviews, which were conducted to gain deeper qualitative insights into patient experiences. More on that later. For community pharmacists, we measured satisfaction with the hospital discharge process before and after the intervention, assess the quality and accuracy of information received with discharge prescriptions by use of surveys titled the Discharge Prescription Survey and the Documentation Tool. And then, upon conclusion of the intervention, pharmacists with direct experience of the TOC intervention were invited to participate in focus groups to share further qualitative feedback. So that's how we evaluated the outcomes. So for our results, starting with patient demographics, we had 88 total patients participate in the study with a mean age of 76. Most participants were white, English speaking, and retired, and a sizable number of these patients regularly took 5 or more medications and self-reported 3 or more chronic conditions. For a closer look into what our standard of care or SOC group looked like, there were more widowed participants living alone, and more participants in this group were female. For our transition of care or TOC group, more patients lived with a partner, were highly educated, and lived in more rural areas. In assessing the outcome of patients' self-reported medication knowledge and confidence, it was found that patient scores for medication knowledge and confidence improved, and it was maintained over time for both groups. For patients' scores capturing barriers to medication adherence, there was improvement over time for the TOC group, but not for the SOC group. And similarly, analyses also revealed that risk for medication non-adherence decreased for TOC patients. Another finding for both groups was that patients identified experiencing medication-related harm related to medication side effects. In fact, TOC patients actually reported more medication side effects than the SOC group, which was interesting. Additionally, as captured by their community pharmacists, TOC patients' discharge prescriptions had fewer reported instances of medication errors and medication-related harm. Now, in the patient satisfaction questionnaire at 30 days, patients were asked 5 questions regarding the medication information that they received during their hospital discharge experience. Results were analyzed descriptively and were generally comparable between groups, with the exception of the question which asked whether patients felt that they had received sufficient medication information before leaving the hospital. This question revealed that 24% of standard of care patients were dissatisfied with the amount of medication information received before leaving the hospital, compared to only 7% of TOC patients. So that was the biggest finding in the descriptive quantitative findings. And then this questionnaire concluded with an open-ended question as depicted on this slide, which was analyzed qualitatively using content analysis. So findings indicated that more standard of care patients, a fraction equal to 3 and 7, provided suggestions for improving for improving support for medication needs post-discharge. And the majority of these suggestions involved better medication education and information. So, as previously mentioned, patients were invited randomly to participate in a 30-day semi structured interview to gain further insights on their experiences during their hospital discharge. So, these interviews were conducted via telephone, and this was, reminder, this was after they had been home for a full month. So we had 25 patients do these interviews with us, and transcripts from these interviews were analyzed via inductive thematic analysis, and major themes emerged. So the major overarching themes amongst both groups are listed on this slide. So overall, patients reported a positive discharge experience and expressed high appreciation for hospital staff who took care of them. Um, And when asked if patients felt informed about their medications, it was interesting that both patients actually felt they felt agreeable that they did receive enough information about their medications. Additionally, patients weren't too fussy as they described it about taking a lot of medications, but they trust that their healthcare providers make the right decisions to take care of them. Also, patients really appreciate their community pharmacists and the ongoing support that they feel with them, well as the rapport that they've established with them. And lastly, patients recognize that they do experience medication side effects often, but there was a popular opinion about across both groups that it is what it is, meaning that the side effects are necessary at this point of their lives to keep them alive. Now, I do want to make note of the fact that standard of care patients had more of a focus on their community pharmacists when discussing information received at discharge. And TOC patients, while also having expressed appreciation of their community pharmacists, had a lot of positive things to say, which reflected the TOC intervention and the TOC pharmacist in the hospital. So, on this next slide, we've included some of these quotes from TOC patients. So, for example, quote one, well, at the hospital, I was asked if I could start a medication on all of my, or could start a test on all of my medications and stuff because I was 65 or whatever. Best thing I ever did. So TOC patients very much appreciated the time that the TOC pharmacist took to sit with them and explain their medications, and they appreciated the take-home medication lists or calendars, which the TOC pharmacist made personalized for patients' needs. And they appreciated the readable terms and talked about keeping these calendars on their fridges and taking them to their doctor's appointments to keep them on track with their medications. So, for example, as the last quote here reads, I've got it up on the fridge where it's, I can see it. If I'm sort of questioning something, I can go to that and make sure I'm doing it right. So, all that was really great to hear. And next, moving on to community pharmacist focus groups post intervention, we invited community pharmacists who had experience processing a TOC discharge prescription to participate. So, we had 10 of these community pharmacists participate in focus groups. So there were two for each focus group and five individual focus groups. And so analysis of focus group transcripts revealed five overarching themes, which are titled in their words on this slide. So number one, TOC prescriptions were more complete, fewer discrepancies, and fewer things that needed to be clarified. They told us that because there were fewer discrepancies in prescriptions, there was less need to contact the hospital and endure challenges that exist with that. And they also really appreciated additional patient information, which they don't always get, including reason for admission and indication for use for medications. Number two was the biggest thing really of note was having someone else's eyes on it as a pharmacist. So they explained their appreciation of especially having a pharmacist who had access to additional patient information in the hospital review the prescription before it left the hospital. One pharmacist referred to this idea as inside eyes. Number three, beneficial for the patient as well as the pharmacy staff. Pharmacists explained that they felt that patients were more knowledgeable upon arriving to the pharmacy, so they could go into counseling with ease rather than starting at point zero. And overall, they felt that the impact of the program through care that they could provide to the patient was beneficial. And number four, when asked if they'd like to see such a program implemented in the future, they said, I would love to see it implemented. Yeah, in every hospital, it'd be great. And number five, they also told us that discharges are very time consuming, whether they're done very well or not good at all. I would also like to mention the pre-satisfaction survey results, although not depicted in our slides, showed some considerable dissent for the hospital discharge process. In those results, frustrations were especially apparent in the lack of time to process prescriptions, the hospital not necessarily being easy to contact, and that patients don't necessarily understand medication changes that happen in hospital when they present to the pharmacy. And these findings were similar to the audit that Carol and the pharmacy intern, uh, which was discussed earlier, what they found in that audit, which helped to inform the study's design. So, as you can see from the focus group themes, we do feel like these challenges were majorly addressed by the TOC intervention. And I also want to highlight that it became apparent in the study's results that community pharmacists are putting in extra efforts to support patients when maybe given lack of information needed to provide optimal care and where patients may be falling through the cracks. It seems as though community pharmacists are stepping in to fill in the gaps that exist. And personally, I think that one of the most important findings from this study is that community pharmacists are doing an exceptional job and require additional information and support to help them optimize patients' medication safety during transitions of care like hospital discharges. So moving on to focus of strategies for real world implementation, we did a single focus group with hospital pharmacists who worked alongside the TOC pharmacists during the intervention in the hospital to gather information on their experiences and opinions on how they could foresee the future of TOC services. So they told us that they felt that high risk or complex patients should be provided enhanced pharmacy TOC services, and an objective tool for identifying such patients would be useful. They also shared the idea that opportunities for student led TOC interventions may exist, such as inpatient medication education, for example. So, key takeaways summarized from the findings of this project include the following. Number one, hospital discharges are complex. Community pharmacists told us that despite a discharge being done very well or not good at all, discharges are time consuming, and this highlights the attention required for handling these transitions and optimizing care for older adults. Number two, community pharmacists appreciated the complete nature of TOC prescriptions which reduced the need to recontact the hospital about discrepancies. And number three, patients appreciated the straightforward medication information given to them in hospital, and the medication calendar or list was especially helpful for them. And additionally, patients exhibited greater knowledge, as described by community pharmacists, and had improved adherence scores after the intervention. So, just to again summarize into some conclusions, um, the TOC intervention streamlined the discharge prescription process between hospital and community pharmacy. The TOC program benefited both providers and patients during this transition. And the TOC program helped patients return home from hospital with the necessary information on their medications. So now we're going to go into the government's current priorities for healthcare and recommendations. Just one second here. So our study showed that when hospital pharmacists work to their full scope, integrate into the care team, and provide TOC services, patients' medication knowledge and confidence improve, and barriers to medication adherence decrease. Our study also showed that improved information exchange facilitates better communication between hospital and community pharmacy teams. And prescription review by hospital pharmacists combined with medication focused discharge summaries reduces the need for community pharmacists to contact the hospital for clarifications, and this leads to more efficient medication reconciliation, reducing occupational stress and resource use. So pharmacy TOC programs would improve healthcare efficiency and effectiveness in New Brunswick. And so based on this research, we recommend expanding pharmacy TOC services. So to improve the information provided to older adults about their medications while they are in hospital, and assess the barriers to medication adherence and work with older adults and their families to find solutions for managing medications safely at home. Um, we suggest to provide community pharmacists with access to the information and resources they need to educate and support patients in their communities, to develop and promote standardized protocols for pharmacists to efficiently handle and document medication discrepancies, minimizing resource use and operational stress. And then we also recommend future research to identify which subset of the older adult population would benefit most from these TOC services in the community and hospital settings. So these recommendations aim to enhance medication safety, improve patient outcomes, and support healthcare providers in delivering effective care. So now we'll tie it back to our story. So if you recall the story of Paul in the beginning, so now I want you to picture uh, someone in your life who's older and um, they suffered an event that led them um, to be admitted to the hospital. And then they started on 5 new medications in the hospital. And a hospital pharmacist reviewed their medications, provided a calendar, gave them a written summary to explain their new medications and what to watch for. They discussed costs, completed a special authorization for their insurance, and answered all of their questions. The pharmacist sent a detailed discharge summary to their community pharmacy. And then when they arrived at the pharmacy, their prescriptions were ready. The pharmacist knew why they needed each medication and reinforced the hospital's information, making them feel confident and prepared to manage their medications at home. At home, say this person noticed that one medication looked different, and they called their community pharmacist who reviewed the discharge summary, explained the change, and reassured them. They scheduled an in person follow up to review all their medications. The pharmacist confidently answered their questions because the discharge summary included all necessary details. Uh, this person felt confident they were taking their medications correctly. So this experience would be very different from Paul's in the beginning, who struggled without support, and Patty, who felt stressed and frustrated that she couldn't help. So, in summary, we did this project because medication errors and adverse drug events are common after hospital discharge, and community pharmacists had concern with the discharge prescription process. And there's a lot of evidence that pharmacists are essential for managing medications, reducing readmissions, and saving costs. And so it's our recommendation that pharmacists be integrated into healthcare teams to improve patient care and the quality of our healthcare. And so we recommend more work to support pharmacy TOC processes. And that is all for now. Thank you for your time, and we're happy to answer any questions that you might have. And we can also be contacted later at the emails on this slide.